Hi, it's Dr. Greg Jantz, counselor, educator, and founder of the Center, A Place of Hope. That name, the Center, A Place of Hope, really is the name. Our clients in a survey years ago kept writing, "This is a place of hope, a place of hope." So we took our name, then was the Center, and now it's the Center, A Place of Hope. So I wanted to share a little bit about how to help somebody who's suffering from post-traumatic stress disorder, PTSD. And I've got some notes of some things I want to be sure to share. And let me just say, post-traumatic stress disorder is a more common diagnosis than one might imagine. Because if you've been a victim of abuse, physical, sexual, emotional, that diagnosis, post-traumatic stress disorder, can apply. If you are a vet, of course that can apply. And so there's a lot of different conditions that can give rise to the diagnosis of post-traumatic stress disorder. And it can have a very profound effect on a person's obviously emotional well-being. Many folks struggle with the symptoms of post-traumatic stress disorder, and they develop addictions, kind of escape. They have sleep disorders, high anxiety, what we call hypervigilance, easily startled, difficulty with trust. A lot of mood swings could be a part of that. So it is characterized, and here's some keywords I've pulled out: intrusive thoughts. So things come to your mind, or flashbacks, things you don't really want to think about, but there it is. Nightmares. And with that, there can be an emotional numbness. You just feel like something's off. And sometimes it's hard to experience joy or enjoyment, and even really to get really upset, that extreme, that seems difficult. There's an emotional numbness. And as you look at the symptoms, yes, they can be troublesome, and yes, they can be there lifelong. And there's periods of time where they can really intensify. So what's some of the common causes that I haven't mentioned? Abuse or violence, an accident, a traumatic accident, a fire, losing your home. So natural disasters that create an earthquake, for example. A loss of a loved one can be also post-traumatic stress disorder. Okay, I mentioned this because, as we know, the symptoms, I've made a list: nightmares, hypervigilance, emotional numbness, avoidance or isolation. You want to avoid people and situations. Here's what's important. Just the bottom line. Listening to a person that's struggling with this and being present and asking questions so that it shows, first of all, you have some empathy with what they're experiencing. And number two, you're asking questions like, can you help me understand that more? How does that affect you? Those are great questions. Help me understand that more. How does that affect you? And the third one is, how can I help, or what can I do for you? Be careful about the yes or no questions. See it as listening with your heart and exploratory questions. Now, sometimes we just want to go right in and try to fix something. This is not the time to try to fix something. It won't be fixed. We need to show great care, concern, empathy. That listening and being with somebody can really be important. All right. Number two, got to be patient. You want this fixed right away. You want to see them better. Yeah, the more pressure that's put on this person who's struggling, the more symptoms could be activated. And I would always say, encourage appropriate, correct professional help. I want to go and see someone or be a part of a program like the Center, Place of Hope, that has a specialty in this area, that I can get help as a team, and it's a whole different experience. There's times that people need that. They need an intensive program. Other times, we can begin with a therapist that really understands what they're doing, and they're skilled, and they have the tools and the knowledge and the care to really help, that's awesome. And if we're not getting better in that setting, then we need to increase the intensity of help. So remember, avoid punishing, and punishing could be like, well, I don't know, why aren't you better? Okay, that's really a judgment that can come across as a punishment. The other thing is self-care. If for you, you do have to have boundaries. Be careful about being swept in all the issues, so that it's you're not eating well, you're not sleeping well, you're starting to have some of the same symptoms. So that's really important to be aware of that. That's why we want to share this with somebody who can really help begin to walk somebody through what they need to have healing and recovery. All right, there's some great treatment options. One of the things that we've got a great couple questionnaires that you can do on the website, aplaceofhope.com. aplaceofhope.com. Look at the tab that says test. You'll see depression, anxiety, and so forth, post-traumatic stress. Take those and see where you score, and you can actually take them for somebody else as well. All right, there's more information in the article. I also want to say there is hope, and this is something that we've been treating now over 40 years, so I know there's hope.